First of all, welcome and very good afternoon. Before starting with anything, may I know your name and it's been how many years since you've been practicing?
My name is Dr. Kaushik Shah and I am in practice from 1990.
Oh my god, that is
Might be before you are born.
Yes, obviously. Okay, so 1990, I mean, it's been 23 years? Yes? 33 years. Oh my god, 33 years. It's a long journey. So obviously experience plays a major role. So we're going to be having topic on OAB, few questions on OAB. First of all, the first question over to you. Can you please describe for the viewing audience that what is an overactive bladder and how does this impact the quality of life of a patient?
The overactive bladder is when the bladder is not able to store properly, and before the patient wants, after a particular period of time, wants to go wide, they have to wide more frequently, and when the patient has a desire, what happens that he cannot control the desire. So the basic human being has the innate ability to control the widening function, and that is impaired, and therefore there is a feeling of urgency, and then they have to go, and in a more severe case they may not be able to control, and then they void in bed or in clothes, and it's very embarrassing, and that leads to severe quality of life deterioration. And particularly as the person ages, there is a self-esteem and the ego, and that is disturbed, and that is worst thing that can think of.
Okay, Harikji was the next one. What is your advice to an individual with overactive bladder trying to lead a normal social life?
The first thing that before they come to know that this is an overactive bladder, they need to consult a urologist to find out whether actually it's overactive bladder or there are many diseases which they are harboring and that is causing this overactive bladder. We normally recommend a diagnosis of overactive bladder only if other diseases of the urinary bladder, other part of the body is taken care of, and then only we label that as an overactive bladder. The first and most important thing is proper evaluation and real diagnosis.
Okay. What is your advice for the behavioral therapy treatment of overbladder?
Yeah, the most important behavior changes is that how much is the fluid intake that they are taking. Many times in community people say that take a lot of water. It is very important for your kidney, for your heart, for your body, for your longevity, and they just flood the body with water, and then they are diagnosed with overactive bladder. So it's important to is fluid management, and if they manage the fluid well, they do well, and this is the most important lifestyle modifications. And second thing is that if they find that you don't need, you will be going for some longer period of time, they empty the bladder. But it should not happen that every time they leave the house, they go wide and then they try to search for a toilet here and there. So that behavior is not important. Important is that at that time they should take a medical care, and there are a lot of medications that can help them to diagnose and treat, and they are all well good.
Okay, lastly, any message for upcoming urologist?
The message for upcoming urologists is that overactive bladder is an important disease. You must not neglect them. You adequately evaluate them, and there are n number of medications that can really help. And even if they have some disease, patients do have the symptoms of overactive bladder, not actually under what you can say idiopathic overactive bladder, but there are suppose urinary tract infection, stone disease, there are so many things, the symptoms are exactly the same, and all these same medications are very useful which we are using for overactive bladder. So use judiciously, think logically, give adequate time to the patient's complaint, and do needful.
Okay, that's all. Thank you very much for your valuable time. Have a great time ahead.